Okay, let's dive in. Picture this. You get a message, maybe a call, maybe you see an alert. Someone you were recently near has measles. What goes through your head? Panic. Questions like, how bad is this, really? And maybe the biggest question, what do I do right now? Today on the deep dive, we're cutting straight to that. We're talking about what to do if you've been exposed to measles. Specifically, there's this critical window for action, and we need to understand why it's so important.
Exactly. And it's crucial. Everyone understands measles isn't just, a bit of fever and a rash. It's actually much more serious than many people think. And it is incredibly contagious. So today, yeah, we're looking at the real risks and that vital intervention window.
Okay, incredibly contagious. That jumps out. How easily does it actually spread? Because I think a lot of us still imagine you need, like, close contact, maybe shaking hands or something. Is that wrong?
Oh, completely wrong. And it's dangerous misunderstanding. Measles spreads through the air.
Through the air.
Yes. Simply breathing the air in a room where someone with measles is or even was recently can be enough to get you infected.
Wow.
Think about being in the same room, same space. That's all it might take. And here's the really unsettling part.
Uh-oh.
The virus can actually hang around in the air, infectious, for up to 2 hours after the person with measles has left the room.
2 hours? Seriously? So I could walk into an empty room and still get it?
Potentially, yes. If someone infectious was there within the last 2 hours and you're not immune,
Yeah.
it's really quite tenacious.
That's frightening. Okay, so it spreads incredibly easily. What happens then if someone does get infected? What are we talking about beyond the fever and the rash? What are the more severe possibilities?
Right. This is where it gets truly serious. The complications are what make measles so dangerous. You can get things like otitis media, that's a nasty middle ear infection.
Okay.
Severe diarrhea is another one, which can be really dangerous, especially for dehydration in little kids.
Right.
But what we see quite frequently, and what's very dangerous, is pneumonia.
Pneumonia.
Wow.
That can be life-threatening on its own.
It absolutely can be. Pneumonia is a major cause of measles-related deaths, particularly in vulnerable groups.
And can measles itself be fatal, even without the pneumonia?
Yes, it can.
Yeah.
Especially, as I said, in vulnerable people, very young children, people with compromised immune systems, or those who are malnourished. It can definitely be life-threatening. And then there's encephalitis. It's less common, thankfully, but it's inflammation of the brain. Very severe.
Brain inflammation. Goodness, that sounds terrifying.
It can lead to seizures, long-term brain damage, even coma or death.
Mm-hmm.
And there's also a very rare but devastating long-term complication years later called SSPE.
Okay, this is clearly much more serious than just a childhood rash.
Yeah.
This really drives home why knowing what to do is critical, especially if you're maybe not sure about your vaccination history.
Exactly.
So let's get straight to it. If someone listening has just found out maybe minutes ago they were near someone with measles.
Or even if you just suspect it and you're not sure if you're immune, maybe you don't know your vaccine status.
Right, what do I do? How fast do I need to move?
Okay, this is the absolute key takeaway.
Yeah.
You must immediately go and get the measles vaccine. But there's a strict time limit.
Okay.
It has to be within 72 hours. Only 72 hours.
72 hours?
Yes. Let me emphasize that 72 hours or just 3 days right after you were exposed to the disease.
Wow, okay, 72 hours, 3 days. That's really specific. Why the rush? What's magical about 72 hours?
It's not magic, it's biology.
Yeah.
Basically, getting that vaccine within that window is what we call PPP, post-exposure prophylaxis.
PP, okay.
Think of it like this. We're basically racing against the virus. The virus is in your body, starting to multiply, but it hasn't made you sick yet. Getting the shot quickly gives your immune system a crucial head start. It stimulates your immunity to sort of wake up and fight before the virus really takes hold and causes the full illness.
Ah, I see. So the vaccine gives my body a chance to catch up and fight it off before I actually get sick.
Precisely. If you get it within that 72-hour window, it can actually prevent you from getting measles altogether.
Completely prevent it.
Yes. Or, at the very least, even if you do still get sick, it can make the illness much milder, significantly reduce the severity of the symptoms, less chance of those dangerous complications we talked about.
Okay, that makes total sense. It's like a deadline, a really important deadline. Get the shot within 72 hours, the faster the better.
Exactly right. So the crucial thing here is don't hesitate. Don't wait around.
Meaning?
Meaning don't sit there thinking, oh, maybe I'm fine, or should I wait and see if I get a fever or a rash first?
You absolutely cannot do that, can you?
No, absolutely not. Waiting for symptoms means you've missed that critical window. The PBP won't work then. The virus has already won that race.
Right. Okay, so let's be crystal clear. If you think you've been exposed to measles and you either know you're not immune or you're just not sure about your vaccine history.
Yes. Then you need to act urgently. Go straight to a hospital or a clinic or whatever healthcare facility is nearby.
Don't delay.
Don't delay.
Yeah.
And when you get there, or ideally, call ahead first. Tell them immediately, I've been exposed to measles and I need to be assessed for post-exposure vaccination within the 72-hour window.
That's a really good point, actually, so you don't potentially expose others in the waiting room, right?
Exactly,
Okay.
especially vulnerable people. So call first if you can. But the main thing is contact them, explain the situation, and request that vaccination urgently.
Okay. Go consult a doctor or clinic right away. Give them all the info because time is literally ticking down from the moment you were exposed.
It really is. And think about it. It's so much better to prevent it now, or at least reduce its severity, than to wait until you're really sick and potentially dealing with serious complications than needing treatment.
Absolutely.
Plus, and this is vital, getting that shot quickly also helps protect others. It stops you from potentially becoming infectious and spreading it further in the community.
That's so true. It's not just about you. It's about protecting everyone around you, especially those who can't get vaccinated. So you really, really must act fast. No delays allowed.
Couldn't say it better myself.
Yeah.
Absolutely no delay. Don't wait, not even for an hour if you can help it. Every minute counts towards that 72-hour deadline.
Okay. So the message is loud and clear. Measles is serious, way more than just a rash. It's incredibly contagious, lingering in the air. And if you're exposed and not immune, that 72-hour window to get a vaccine is absolutely critical. It's potentially life-saving, and it's non-negotiable.
That's the core of it. Immediate action within that time frame.
This deep dive really hammers home how crucial, quick, informed action can be.
It does, and it makes you think, doesn't it? Understanding this very specific, very urgent window for measles, how does that change how you think about other diseases that spread quickly?
That's interesting.
You know, thinking about that balance between your own health, acting fast for yourself, and how that immediately impacts community protection. It really highlights the power of timely medical intervention, not just for measles, but maybe for future public health challenges too. Something to definitely reflect on.